Welcome back to another episode of the Chijons Health Awareness Series. My name is Chidima. I hope you remember we've had several episodes on various health topics, and I hope you've been following this series and you've been enjoying them and getting your questions ready. Today we have another special topic. We are going to be talking about a disease of the liver. Yes, the liver is a very important organ in the body, but it's also prone to diseases. And what we are going to be talking about today is hepatitis, a very serious topic. Now, hepatitis is an infection of the liver. If you want to translate it literally, it means inflammation of the liver cells. Now, there are different classes of hepatitis. You have the A, you have the B, you have the C, you have the D, and the E. But we are going to be talking about hepatitis B today. And the reason why I'm talking about it is because it's prevalent in the world. You have a lot of people that are coming down with hepatitis B, and it's one of the most serious hepatitis infection. Now, what is hepatitis B? What causes it? It's caused by a virus. A virus is a pathologic organism, and it attacks specifically the liver cells, which the liver cells are very important and help to process fats and various substances in the body. Now, when we talk about hepatitis B, how can somebody get it? How do I come across hepatitis B? Is it just by walking on the street that I'll get hepatitis B? No, of course. Hepatitis B is transmitted through the blood, through sexual fluids like the semen and the vaginal fluids. Then you also have through sharing of sharp objects. When this person uses a sharp object like needle, maybe sharing needles with other people, or using blades, sharing razors, those ones can carry hepatitis B infection if an infected person uses it and someone that is not infected uses it. So hepatitis B can affect both adults and children. In children, you might say, how can they get hepatitis B? They can get it through mother-to-child transmission at birth. When a mother that is infected with hepatitis B gives birth to a child, as the child is passing through the birth canal, the child can become infected with hepatitis B. Then you can also have it being transmitted from children to children. For example, when you have children playing and you have bites and scratches, and you have a child biting another child that is infected with hepatitis B, if there is an outlet of blood, if blood comes out and that blood touches the child's mouth, then the child that is not infected can become infected. Now, what are the symptoms of hepatitis B? How do you know that you have hepatitis B? Sometimes hepatitis B can be silent. In chronic infections, the person might have hepatitis B but doesn't know that he has it. And sometimes at the onset of infection, that is when the pathogen just gets into the person's system, you can have flu-like symptoms, or as we are more familiar with, malaria-like symptoms, maybe body pain, catarrh, headache, that may just go away or resolve on its own without any treatment. Or at other times, you might have complications. This is when the hepatitis B virus has overpowered the immune system. Then you can have symptoms like yellow eyes, yellow palms and feet. You can have yellow urine. You can also have swollen stomach, also known as ascites, that is due to inflammation of the liver. So these are some of the symptoms that you have. And one major complication of hepatitis B is liver cancer. In fact, it has been known as the #1 cause of liver cancer in the world. So we'll talk more about how to prevent this hepatitis B. How do you make sure that you don't get it? Then, if at all you have it, how do you manage the symptoms so that it doesn't become a complication? So we'll stop here for now, and in the next episode we'll talk about these topics I've mentioned. So I hope you come back and join us on this series so that we'll complete this topic and you'll be more enlightened on what hepatitis B is all about. So we've talked about the definition of hepatitis B, how you can get it, and the symptoms that it comes with. Next time we'll talk about prevention of hepatitis B and management of hepatitis B. I hope you've enjoyed this topic today and you've learned a lot. Please join us next time for another enlightening session. Until then, stay safe and have a good time.